Whether you have lower back pain, upper back pain, or your mid-back hurts when you look down, today I'm going to show you how to fix back pain at home with self-myofascial release. Hey beautiful humans, I'm Sukie Baxter, founder of Whole Body Revolution, where I help you to rewire yourself for greater health, happiness, and success. If you're new here, make sure you remember to subscribe, and all of the links to the things that I mentioned in this video you can find linked in the description box below. Let's get into it. For this exercise, you're going to need 2 small soft balls that have some give to them. You don't want to use something hard like a lacrosse ball. Pain is actually going to be counterproductive to this practice because this exercise actually calms the nerve ganglia or nerve bundles that run along the front of your spine. These nerve ganglia are connected to your body's stress response, and if you cause yourself too much pain by being too aggressive with this practice, you're actually just going to perpetuate the pain cycle and cause your body to tighten up more. The balls that I'm going to be using are called pinky balls, and I will link to those in the description box below. Okay, so what you're going to do is place the balls behind your shoulders, and then you're going to lie down with the balls under your trapezius muscles. Go ahead and bring your arms up, and you're going to clasp your elbows with your hands. And we're just going to start by slowly letting your arms drift side to side. So you're just going to start by letting your arms go to the left and then to the right. And now we're going to add in a head movement. So as your arms go to the left, allow your head to fall to the opposite direction. So your head's going to turn to your right. And we're just going to stay here for a moment. And then we're going to switch sides. So your arms are going to come to your right, and your head's going to fall to your left. One more time to the opposite direction. So arms are going to go to your left, head's going to fall to the right. And notice here if you're having a tendency to hold your breath. Notice if there's any tension in your face, in your jaw as you're doing this. And switching sides and going to the right with your arms, and your head's going to turn to your left. Okay, so now we're going to move these balls to between your shoulder blades. Go ahead and bring your arms up, and you're going to again clasp your elbows. And again, we'll just start by letting your arms drift to the left and to the right. And as you're doing this, you should feel the pressure change and move in the balls that are on either side of your spine. So effectively, we are shearing the tissue. We are kind of moving it side to side against the pressure of the balls. Okay, so let's go ahead and add in a head movement. So your arms are going to fall to the right, your head's going to turn to the left. And the other direction. Again, noticing if you have a tendency to hold your breath, noticing if you're tightening your jaw, if there's tension around your eyes. And just going back and forth with your arms and letting your head fall in the opposite direction. Okay, so now we're going to move the balls again. So we're going to move them down just a little bit to, would be just below bra strap line on women. And this is the area where your psoas would attach on the front of your spine. So it would attach on the front end, on the solar plexus side. But this is the area of your spine that it affects, and it's also where your diaphragm attaches to your rib cage. And so a lot of times there will be some tightness in this area that I find with clients when I'm working with back issues. So just trying to get mine even here. Now making sure that you're not putting them too far down. You don't want them in the curve of your back. You just want them right at the base of your rib cage, right above the curve of your lower back. And again, we're going to bring our arms up and clasp your elbows. And we'll just start with letting your arms go side to side. And your psoas, the upper attachment of your psoas, really is the juncture between the lower body and the upper body in a sense. It's the center of your body, your core. So now as you're doing this, because your psoas is actually a leg muscle as well as a core muscle, we can start to get our knees involved a little bit. So let your arms drift to the left, and you're gonna let your knees gently fall a little bit in the opposite direction to the right. So you're getting a little bit of a twist through your torso here. And then we'll go the other direction. So your arms are gonna move to your right, and your knees are just going to go a little bit to your left. Now this doesn't have to be a big movement here. It's just shifting the weight of your pelvis a little bit to the left so you get a tiny little bit of a stretch in the opposite direction from your arms, and you get that twist across your center. And the other direction again, so arms to the left, and your knees are going to fall to the right. And one more time to the other side, so arms to your right and knees to your left. Again, noticing if you're having a tendency to hold your breath, tighten your jaw. Make sure your tongue is relaxed in your mouth. Noticing any tension around your eyes that you may be holding on to. Noticing if you're trying to furrow your brow. Make sure your toes are relaxed. And back to center. So now let's go ahead and move these down, and we're going to put them right about your SI joints, which is right at the base of your low back, at the top of your pelvis. So it would be just below the curve of your low back, just below the waistband area of your pants. And from here, we're just going to use our knees to give that same stretching of the tissue. So you're just going to let your knees fall slowly to the right and to the left. Again, this is a very small movement. You don't need to be going all the way to the floor or even close to that. And moving very, very slowly, because we're giving a nice gentle stretch to this tissue. We don't want to be too vigorous, because what we're doing here is actually sending data to the brain, and I'm going to talk more about that in a second, but we're sending data to the brain that causes it to relax the muscles, and if you move too quickly, your brain misses the signal. Gently letting your knees fall to the left and back to the right. Okay. So then we're going to move the balls again, just a little bit lower, maybe 2 or 3 inches, and we're going to put them really close together. So you want them right next to each other, and you're going to put them right on your sacrum. So this is not your tailbone. We're not putting them down that low, which would be the pointy part of your bone that you feel when you sit for a long period of time and it gets really tight. But it is the triangular shaped bone at the base of your spine. And this should not be overly painful. It might be a bit tender, but if it's excruciatingly painful, then don't proceed with this. So with those balls placed under your sacrum, you're just going to gently let your knees fall again to one side and the other. And this is basically the same practice, just noticing if you're holding your breath anywhere, if there's a tendency to tighten up against the pressure. Again, it doesn't have to be a big move. We're just shifting your weight. So you'll feel a little more pressure when your knees go to the left on the left side of the sacrum with the left ball. And then as we go back to the right, you'll feel it shift towards that side. And then go ahead and take those out, and you can feel just lying here that your back is probably a lot more relaxed. There's probably a lot more contact with the floor already before you even get up. And there you have it. This simple self-myofascial release exercise will relax your back muscles and ease pain. But before I let you go, a quick word about myofascial release. A lot of people think that when you're using these balls to release tight muscles, that what you're doing is breaking up adhesions in the tissue, and that one, you need a lot of pressure to do that, and two, that it's gonna hurt. And if it doesn't hurt, it's not effective. So it's really important to understand what's really going on here. First of all, you're not breaking up adhesions or anything else. Studies have shown that it takes about 1,000 pounds of pressure to displace fascia even 1%. Basically, you would need an elephant to stand on you and then you'd be dead. So that's not productive. Secondly, what you're actually doing is providing something called novel sensory input. And those fancy sounding scientific words basically mean that you're causing your body to feel something that it usually doesn't. The exercise we just did actually provides input through shearing of the tissue against the surface of the ball, and that's why I had you move your arms and knees. That movement provides microstretch that stimulates a certain kind of cell in your skin and fascia called Ruffini receptors that sense pressure. Sometimes different areas of your body become frozen or stuck due to habitual movement, injuries, emotional pain, trauma, and then you'll proceed to hold that part of your body still kind of subconsciously. But by giving your body this novel sensory input, we're essentially resetting your nervous system and dissolving the frozen muscles, allowing you to move again. However, if you're too aggressive with your myofascial release and you cause yourself a lot of pain, then it simply perpetuates the stress response that's already active in your brain, causing you to freeze that part of your body and further locking you into the cycle of pain and stiffness. That's why it's important to do this exercise slowly, staying within your own level of tolerance. It doesn't mean that the practice won't be uncomfortable at times, but that discomfort should feel productive rather than painful. Thanks so much for watching this video. If you like it, I'd appreciate it if you'd hit that like button, and definitely remember to subscribe so you never miss a video update. I'll see you in the next one.